this session is all about sharing emerging innovations, growing areas that are important for you all to hear about, learn about, and also to talk about what other steps can we be taking or things that we should be doing in the early childhood space. So what we're going to do is you're going to hear presentations from our 4 speakers about some really exciting things happening or that they're working on. And as you're listening, I want you to be thinking about those questions of what ideas do these presentations spark for you, or what are next steps or actions that you all could be taking back home, because after their presentations, we're gonna have about 20 to 25 minutes of conversation at your tables where we're going to do some brainstorming and talking about exactly that. So I'm delighted to be here with you all today and to introduce our panelists who are doing some really exciting work. First, we're going to hear from Natasha Frost from the Public Health Law Center. She's a staff attorney who provides legal technical assistance to stakeholders around the country in developing effective policies to promote healthy eating and active living. And we are going to learn a lot about broader child care issues she's working on and how licensing laws can play into that. So I'll turn it over to Natasha.
Hello. So I'm Natasha Frost. As Megan said, I'm from the Public Health Law Center, and we are located in St. Paul, Minnesota, but we do work nationally. And we've done a lot of work in areas related to healthy eating, active play, and biking and walking, and tobacco control. And what we're going to focus on today is our work in the child care setting, which, so we're kind of new to this field. In the last 5 years, we've done a lot of analysis on the child care licensing law. So I have read every single state's child care licensing law, and many of you have heard me talk about it, how fascinating it is. And I want to say that, thank you for all of you who are doing such hard work to get those laws changed, because I have to continue updating and reviewing the child care licensing laws because there's been so much energy and attention on those. And so we have a website that we're actually constantly updating. I feel like at every presentation, I'm like, yes, we're updating that at the end of the month, where we have the licensing laws for each of the states. And I'll go over what we've done with those licensing laws that will help advocates and stakeholders across the country. There's a whole highlighting protocol that we go through. But before we dive into that, I really want to kind of carry on the themes that we've been talking about throughout our time here. And one of the things is this kind of the importance of focusing on policy and program, and what we're looking to kind of where our attention is in this area. And so I'm going to talk, I'm really, a lot of the work that I do is around policy, and we've heard a lot about program, and so those are both very important. But I do think that we need to really take a step back and look at how institutional racism and white privilege plays into both of those components. And when I was doing my read of these licensing laws, I focused on healthy food and active play. But one of the things that was really striking is two things are my main takeaways is, there is a lot of that kind of embedded institutional racism that actually is happening within the regulations. And we need to really look at that, and we need to think about how that's affecting our families. We've heard talk today about how a lot of people are going underground, they're not being licensed. And if we're trying to impact this community through licensing laws, we need to make sure that those licensing laws actually apply and provide quality care to all of the kids in childcare. And so thinking about that, I'll give you an example. We didn't code for it, but man, English as a requirement in some states for both small family homes and childcare centers, which was pretty shocking. And it's really, thank you. It was really shocking to me to think, oh gosh, has anyone even challenged that? Has anyone thought about how that's impacting our families and our, immigrant communities? But those are the sorts of things that I think all of us in this room need to look at how that institutional racism is playing into those licensing laws or CACFP or the implementation of some of our programs that we're looking at. The other thing that was really shocking to me is the real focus that we're having on childcare centers. Honestly, childcare centers are great, especially focusing on high-quality, high-performing childcare centers. Where we need to focus is small family homes and family-friendly neighbors. And And that's really interesting from a licensing perspective because many of those folks are not covered by our licensing laws. They're either legally exempt or they're actually just not going through the licensing process. And I think that's a really interesting conversation to have on how, and Dr. Killens had that chart of equity, which was, I love that. I can't wait to get that slide. Because if you think about where we need to invest our time, energy, and programs and just technical assistance, it's in those small family homes and those family-friendly neighbors who might be out of the range of our licensing laws to make sure that they have quality care. I mean, we keep hearing it over and over again about kids in poverty may not be going, and actually we have the statistics, are not going to high-quality licensed childcare. So we need to figure out how we can use these policy levers to impact those kids. And I would just really, I'm challenging all of us to have that honest conversation about how that institutional racism plays into what we're doing day to day, and how that white privilege actually as a lens can really be a tool for us to look at those and ask those hard questions. All right, now I'm moving on to my slide of this is what we have done, and I'm so excited to think about how to expand this, because what we've done is we've actually identified all the different settings in each of the states, and they're all over the board. I mean, like North Dakota has 7 settings. So when we talk about child care centers and small family homes, like North Dakota has 7. And that's only the ones that we coded. And there's some that have registered homes, which are kind of more in that family, friend, and neighbor, all the way up to kind of big child care centers versus small child care center or small child care centers. And so thinking about, we have the information, we have it, all the data, and we're really willing to share kind of what types of care exist in each of the settings, how the different regulations apply to nutrition standards, active play standards, screen time, playground safety. Those are the sorts of things that we actually have highlighted, and we can pull data for those of you who are working in this area. One of the things that we did recently, which I'm pretty excited about because it was such a long road, was to figure out which states are going to actually automatically update when the new CACFP rule comes out. Many states embed CACFP or CACFP concepts into their licensing regulations as nutrition standards, which is great because it gives the providers at least one place to go for those nutrition standards. But not every state is going to automatically update. And so we went through, and because I'm an attorney, I had to do should update because we don't know for sure. It should update, but and that's that top example where we have these codes for each of the settings. So North Dakota, we have 7 codes for the different settings in North Dakota. And it's whether or not they should update, like Iowa, where it clearly links. There's no other embedded problems like a chart or a linkage to a date. You know, Massachusetts, which has one regulation for all the different settings that they have, they are probably going to update, but we don't really know. So it's in the may update category. So folks in Massachusetts can actually work with state licensing agencies to figure that out. And then there are places like California that actually link to CACFP from a particular date, like 1990, that aren't automatically going to update with the new rule. So we have this information for researchers and stakeholders. And this is, again, our webpage. We have those different charts that we're going to do and analyses that we're going to do thanks to a lot of great funding sources like Voices for Healthy Kids, the Healthy Eating Research, the YMCA of the USA. And I would just encourage you to take a look at those pages. Thank you.